The feeling is we cannot have the problems that our mothers had for our daughters to have the same problems that our mothers had. So we decided to focus on this initiative. And the reason is that, especially when we come from a place like here, where I grew up, if you look at the kind of hospitals and the kind of facilities we have next to the community itself, they do not reach the level that we would probably aspire to have. So our plan is to equip the hospitals or the facilities closest to the people so that our mothers do not have to travel long distances looking for adequate facilities. In fact, Daktari has actually mentioned the perfect example, because if we have our mothers, even I'm at the point now I can even say our daughters, giving birth without the proper facilities or the proper professionals to assist with the delivery, then we have a lot of maternal deaths, even for the infants that are born. So that is what we are focusing on, and I'm very happy and proud to have come back home, because I think so far we've done this to 7 community hospitals, and we'll keep up equipping hospitals as we go along all over the country. But this is a special one, especially for me, because I've come back home to assist with this kind of initiative. So for us as Sportpesa, we will keep making an impact in the society in terms of healthcare. Those are some of the things that, and as Daktari said, if you have an unhealthy community, then you cannot say you're prospering as a society.
When you touch hospital, you actually touch the lives of every person around here at Kenya at large, because health has no borders. We know once we have good health here at Mikidori, Meru at large will be healthy, and the Kenya national at large will also benefit from this good initiative. So you may be touching just this local area, but remembering the children who will be saved here through those incubators and maternity good services will translate to the larger health of our county and the good citizenry of our country. So we applaud this and encourage any other person who may be willing to assist us in any aspect of development in Meru County. Our government, through His Excellency Greater Moroge, is very, very accommodative and actually attractive, and giving the very best enabling environment for any person wanting to develop Meru County to play their role, and they feel appreciated, because for sure health is life. With good health we can realize other developments. We cannot make Meru great when we have sick people or unhealthy people.
We serve a population of around 30,000, known as Tigania Central, that is going to be recognized soon. So we serve as a referral center to the surrounding health centers and dispensaries. So today our main focus is maternity, where we have a bed capacity of 14, and that has an turnover of around 100 deliveries in a month. So the beds that are there have been in place, like I said, since 1999. So we have received today new beds to replace the old one, and also with the high turnover, we have a bit of complications that arise. So we were to start a newborn unit, and to do that, of course, we needed incubators. So as it is today, we've also received 2 incubators for them, for the facility. Those ones will go a long way, because I can tell you for a fact, if you have a preterm baby born here, of course you have to refer to Meru level 5, and even with the best ambulance, most of them die along the way. So those 2 ambulances will go a long way